welcome back to my channel. Thank you so much for tuning in. If you're new here, this is a nutrition and lifestyle channel. On this channel, I give you very easy, very simple tips and tricks that can help you embrace a healthy lifestyle. So please consider subscribing and turn on your notification bell so that you don't miss out on videos that I post. The last time you were here, we were discussing about cancer and we were talking about how to keep good nutrition before, during, and even after treatment for cancer. And especially we were talking about the side effects that come about when you have undergone chemotherapy as a form of treatment for your cancer. And we discussed quite a lot, but today we are going to talk about a quote that is a very, very common quote, and it goes like, when your diet is right, then medicine is of no need. Okay, when your diet is right, medicine is of no need. And we are going to talk about so many conditions, how many diseases that you could actually prevent, or you can easily manage it, not necessarily with medicine, but with your diet. So when we're talking about nutrition, we are talking about all the food groups. We are talking about the importance of having good nutrition, whether you have diseases or not. Okay, and most especially in nutrition, you want to focus on the prevention rather than on the cure, because there are so many things you could do with your diet that would prevent you from getting into serious medical conditions. The first disease or the first condition I want us to discuss is obesity. So how does obesity come about? How do you know you are obese? We use BMI to tell if you're obese, overweight, underweight, or you have a normal nutritional status. And so when your BMI is above 30, that means you're obese. And obese comes about when you have a very poor diet habits, very poor eating habits. You're consuming a lot of junk, you are physically inactive, you are eating more than what your body needs, your portion size is a bit bigger, then you develop obesity. And when you have obesity, you are introducing so many other medical conditions to your body. You are talking about heart diseases, you're talking about diabetes, you're talking about high blood pressure. The more diseases you have in your body, you're giving your body a very, very difficult time. Okay, so obesity is a condition you can easily prevent by eating right, by making sure your diet is right. And in this case, I'm talking about portion control. Okay, I have done a video on portion control and I've talked about portion control so many times. Portion control is very important for weight management. Okay, you don't want to get to obesity, you want to prevent obesity, because weight loss can be very difficult for most people, and so you don't want to get to a state where you will have difficult time managing it. If it's your portion control that is the problem, you need to change that. If it is your food choices that has a problem, you need to change that. And I also did a video on food choices. You need to make your food choices right all the time. In this case, when your diet is right, you're preventing obesity, you're preventing occurrence of other cardiovascular diseases, and therefore medicine will be of no need. The second condition I wish us to talk about is type 2 diabetes. Okay, type 2 diabetes has become so common these days, and mostly it comes because of lifestyle changes. Okay, most people these days prefer fast foods, prefer takeout, prefer junk, and therefore they develop obesity. Like I've said before, obesity predisposes you to the risk of developing type 2 diabetes. Inactivity, physical inactivity, predisposes you to developing type 2 diabetes. And when you have type 2 diabetes, of course, you'll need to be on medication. Okay, and the more uncontrolled your diabetes is, the more medicines you're going to use. So in this case, we are going to talk about not prevention, but you already have type 2 diabetes. Okay, diet for diabetes is very important. Keep in mind moderating your sugar intake. Okay, keep in mind physical activity, never forget to be physically active. Portion control when it comes to diabetes is very important. And we also have the diabetic plate, where half of your plate is vegetables. Okay, half of your plate is vegetables, and that is very important because the fiber in food helps you control the sugars in your blood. And more so, uncontrolled diabetes has so many complications. Okay, you see people with diabetic foot, you see people with poor eyesight, you see people with kidney damage, and the more medical conditions introduced to your body, I think that introduces more medicines to your system. So following a very strict diabetic diet helps you also prevent occurrence of diabetic complications, and therefore you're able to also reduce the amount of medicines that you take. Third condition we're going to talk about is high blood pressure. Okay, high blood pressure may be caused by smoking, intake of alcohol, stress, poor dietary habits, and so much more. So high blood pressure is also linked to diet. You need to adjust your diet when you have high blood pressure. You're already diagnosed with high blood pressure, you need to adjust your diet. For example, if you continue increasing your intake of salt and you already have high blood pressure, you will be unable to manage your blood pressure. I'm going to add a link to the video that I did on high blood pressure, the diet mistakes we do when you have high blood pressure. Because you need to limit your intake of salt, because of course sodium increases your blood pressure very, very fast. So in your diet you need to limit the use of salt, especially added salt, the table salt. Okay, you also need to increase your intake of fiber, foods rich in fiber. You also need to increase intake of food rich in potassium. Okay, so you see the link between diet and high blood pressure. It's very important. And again, like I've said in management of diabetes, when you have high blood pressure, that means you're already on medication. Okay, and the more uncontrolled your blood pressure is, that means the more medication you use. Again, same thing here. When you follow a good diet, when you follow the dietary guidelines for high blood pressure, that means you're able to also reduce the amount of medicines you're taking to manage your blood pressure. Another medical condition that can be easily controlled by diet is tooth decay. I think so many people have problems with their teeth, and it's because of diet. You're eating too much sugar from sweets or from foods, and maybe you have very poor dental hygiene, and therefore that sugar leads to tooth decay. And when you have tooth decay, are you able to eat very well? Are you able to continue eating as you always do? No. When you have tooth decay, you might have pain, and that will limit your nutrient intake. So tooth decay is something that you can also control by simply following a good diet. And in this case, if you don't have tooth decay, you don't need medication. Okay. Lastly is anemia. Okay, and I'm going to talk about the iron deficiency anemia, because that one is the one that is linked to diet. When you have anemia, what happens? You become fatigued, you become weak, you develop severe headaches. You cannot even do your normal activities as you'd wish to. You also have loss of appetite. You also have nausea. You can also develop vomiting. That has a very adverse effect on your nutrient intake. And so you need to increase your intake of foods rich in iron. In this case, red meat, we are talking about fish, we are talking about spinach, we are talking about beans, we are talking about peas. All these foods will help you resolve the anemia, even with no need for medication. Okay? So in a nutshell, what I'm saying is, even though prevention is better than cure, sometimes you step into the hospital when you already have that medical condition. And when you are advised to adjust your diet here and there, it's very important for you to follow those guidelines, because that will help you also reduce the dosage of medications that you're taking, reduce the number of medications that you're taking. So thank you so much for joining me today. I wanted this video to be as short and precise as possible. I'm going to leave a link to the video that I did on diabetes and also the video that I did on high blood pressure, so that you can get to understand all those diet mistakes that we keep making, that you can easily prevent, that you can easily stop making, okay, and make your diet right, so that you don't need medication. Okay, when your diet is right, medication is of no need. Okay, until next time, bye.